Hi, students. I'm Dr. Madewell, and I'll be the professor for this short 7-week accelerated class on neuropsychology. To get started this week, many of you already posted your goal orientation. Thank you for doing that. If you are interested, make sure to read the announcements that are coming. You can see there are announcements from me asking you last week to post the goal orientation. Thank you for those who did that. And you'll see there's messages from Faith talking about getting your Sona account set up. Make sure to get that done. Follow her messages and email her if you have any questions related to Sona System. Sona Systems is an external tool that we use that connects students with researchers from our community. All the researchers in our community that post their studies on Sona, their research study has been approved by the Southeastern Institutional Review Board, meaning they're ethical because the researchers plan to treat you as a human ethically, and then your data will be anonymous. Okay, so go ahead and participate in studies. Also, underneath announcements, you can see the syllabus. And next, you'll see modules. Modules are super duper important. If my computer will load, we can continue to wait here. Click it one more time. All right, now when you go to modules, I have in here that I want you to watch this movie called Concussion. I did find it free on Tubi, but if not, I find that it's about $3.99 on most sources. Go ahead and watch that so you can be preparing for your final presentation. This movie, Concussion, it details the story of Dr. Omalu, which you'll be reading articles from him this semester or this term. And Dr. Omalu pretty much was not fazed by how football is so powerful in the Americas. And he just really cared about the players and how repetitive concussion was causing little internal bleeds. And what we, the people, were seeing were that maybe a stereotype, a negative stereotype of what a older football player might look like, which was very negative. And kind of what a lot of people were saying before Dr. Omalu's findings is that football players were prone to early dementia. And that actually wasn't the case. And so it's pretty interesting. I want y'all to be reading research articles about head trauma. Watch the Concussion movie. If there's another movie y'all are familiar with that talks about brain injuries in another sport, we're not talking about one injury. We're talking about repetitive brain traumas. That happens in rodeo, that happens in rugby, not just American football, but if you want to talk about a different sport, that is fine. Okay. But go back. So through this term, I'd like you to watch that so you can begin preparing for the course. Here you can see information that Faith has posted about Sona. Please read that and get all set up. Ask her if you have any questions. You can always ask me, of course, as well. Here I want you to be reading this module and be thinking about, do you want your children to play football? If your paper at the end of the semester is about rugby, then it would be, do you want your children to play rugby, or do you want your children to do rodeo or something like that? Okay, so just stick with the topic you want to talk about. And then here you can see week one. Every week has an introduction. Make sure to click on that. You can see what I want you to be learning and what I want you to be doing. Okay. Again, this is a 7-week class. It's accelerated. The US government is giving you 3 credit hours for this class. That means you should be spending 17 to 20 hours a week on this course. Okay. So that's what my weekly modules are delineating. Some of you might spend more or less depending on your reading abilities. So plan accordingly and plan your time wisely. Go ahead and get started this week. If and when you have questions, reach out. My office hours are on the syllabus and on all over the course. If you have any questions, I love to just talk to you. And if you want to just join me via Zoom, that's usually the best way to get me. Because I'm on Zoom all the time. But feel free to reach out. I'm a human, I'm not a robot, and I'm here to help. Talk to you soon. Glad you're here.